Hello and welcome to Maximizing Longevity and Quality of Life for Neuroautoimmune Patients. My name is Adair Anderson. I am the Product Marketing Educator here at Vibrant and want to go over some housekeeping items before we get started. All attendees are in listen-only mode. If you have questions during the presentation, please submit them as a comment. There will be time at the end for Q&A. Also, this webinar is being recorded, and you will get a copy of the recording and the slides after the webinar ends. And now I am pleased to introduce you to our speaker, Dr. John Bartemus. Dr. Bartemus is a chiropractor, certified functional medicine practitioner, and board certified in integrative medicine. He's practiced functional medicine for 15 years in Cornelius, North Carolina, and excels at getting results with chronic disease cases where conventional medicine has failed. Dr. Bartemus has over 1,100 videos on his YouTube channel where he shares his expertise with doctors and patients alike. He is an Amazon #1 international best-selling author of the book, The Autoimmune Answer, and is currently working on a second book. Take it away, Dr. Bartemus.
All right. Thank you, Adair and Eliza and the whole Vibrant Wellness crew. Thank you for the opportunity to speak to your tribe and to all of those who are out there listening live and in the future. I appreciate the opportunity to positively influence your education and your path towards helping patients. So like Adair said, I am a chiropractor in North Carolina that does functional medicine exclusively. I no longer adjust patients because my passion is the functional medicine detective work side, and so that's my focus. However, I do believe chiropractic adjustments are part of a perfect healthcare strategy, so props to the DCs out there who are still doing it. Thank you and welcome to any MDs, DOs, PTs, other NPs, PAs, all the practitioners here. We all have a role and we're all needed as we move forward in the healthcare of America and hopefully out of this country too, to the listener. So today, maximizing longevity and quality of life in the neuroautoimmune patient. What is a neuroautoimmune patient? That is a patient with a neuroautoimmune disease ranging from multiple sclerosis to PANS, to autism, to Parkinson's disease, there's a whole list of them. And I'm excited today to share with you strategies on how to help these patients. And I want to encourage you to not be scared to take these patients on, because you are the only doctor that can help these patients, and you'll understand why today. So I'm going to give you 3 case studies from my office: 1 multiple sclerosis, 1 PANDAS, 1 autism. And through these cases, I hope to show you the approach that I use and the testing that I use to help you be able to do the detective work to crack these cases and help them where conventional medicine strategies have not. So in order to do that, we have to become Batman. And I like Batman as a metaphor for us as clinicians, because Batman's just a normal guy. He doesn't have any superpowers, okay? He has technology, but he has no superpowers beyond the 3 keys to success that I want to share with you. We can all share these keys to success with Batman. The first key is a commitment to CANI, which is an abbreviation for continuous and never-ending improvement. If you are committed to continuously and never-endingly improving yourself, then you will be Batman. How soon? Just depends on how committed you are. Okay, so focus on continuous improvement and you will be the Batman for your city. The second key to success for us is to have a fervent desire to master the physiology of the patients in front of us, right? In the functional medicine space, there are doctors that market themselves as the thyroid doctor or the diabetes doctor or the cancer doctor or whatever it is. I think that that's kind of off base. I understand from a marketing standpoint why you might do that, but I hope behind the scenes you're really a functional medicine doctor. And the nuance there is that the thyroid can't be separated out from the rest of the physiology of the patient. Diabetes isn't separate from the rest of the physiology of the patient. Neither is cancer. So we need to fervently desire to master physiology every single day. Continuous and never-ending improvement in our knowledge and mastery of physiology, because otherwise, if we're just focusing on the thyroid of a thyroid patient, we're addressing that patient no different than conventional medicine does, right? They just see Jane as a thyroid, give her Synthroid, send her out the door. We need to step back and say, Jane, the thyroid symptoms are interesting, but they're not happening in a vacuum separate from the rest of your physiology, your lifestyle, your environment, etc. So let's know physiology so we can optimize the returns on our investment in these people. And then lastly, we need the tools to help us achieve what others can. And that's what Batman has, right? Batman's just a normal guy with some good martial arts training and some excellent tools. What's he have? He has a Batmobile, he has the Bat boat, he has the Bat jet, he has a tool belt with every tool possible that he would need to take down the Joker or Bane or the Riddler or whatever he's facing, okay? And so we want to have those tools, and those tools are provided to us through Vibrant Labs and their tests. So let's move forward as Batman to learn how we can better serve our Gotham cities. Adair did mention that I have published a best-selling book. You can find that on Amazon, and it is called The Autoimmune Answer. It's available in paperback, hardcover, ebook, and on Audible. So any way you like to consume info, you can find it there. And I'd encourage you that if you like today's presentation, the book has 10 chapters and 13 or more case studies from my office in it on various autoimmune diseases. And none of the presentations, none of the cases from today are repeated in the book. So just so you know, I have more than 13 patients that I talk about in the book, but you can learn a lot about different autoimmune diseases in that book. So check it out. If you love it, please leave an Amazon review for me. That helps spread the word. And one other note there, I wrote the book to help reach patients, of course, and help them realize that there is a healthcare paradigm out there that excels with chronic disease, which is functional medicine, versus the conventional healthcare model, which is very poor with chronic disease. The conventional model is great with acute disease. Functional medicine isn't really armed for acute disease. So we all have a place, but the problem is that patients often get stuck with a chronic disease, which is the majority of disease in America, in an acute care model, and that's why they aren't helped. A second reason I wrote this book is because I want to reach practitioners and swing them to the functional medicine paradigm. I believe functional medicine is the 21st century healthcare. It's the future of medicine, and we need more doctors doing it. There's a projection that by 2030, there will be 120,000 doctor deficit in America. So there is no shortage of patients, and there's not enough doctors to serve them. So you don't have to be worried about, these are my patients, not yours, okay? We need to be worried about recruiting practitioners to help us. And the powers that be have noticed this because they've started to enlarge the scopes of practice for second level practitioners like nurse practitioners and PAs because they realize there's not enough physicians. So if we can get physicians on board practicing functional medicine, that's going to help everybody. So spread the word that way. Let's start with Jordan Peterson. To learn is to die voluntarily and be born again, in great ways and small. So speech must be untrammeled so that dialogue can take place, so that we can all humbly learn, so that truth can serve love, so that suffering can be ameliorated, so that we can all stumble forward to the kingdom of God. Okay, so I hope this presentation today causes you to die voluntarily and be born again in a functional medicine paradigm. I hope this whets your appetite to pursue functional medicine and pursue Vibrant Lab testing further so that you can further look under the hood of the patients that you see and connect the pieces of their puzzles to help them stumble forward into the kingdom of God, or contextually stumble forward or climb closer to optimal health each day with your assistance. And then you as the doctor, seeking to continuously and never-endingly improve, can stumble forward to the best version of yourself, most knowledgeable version of yourself possible. This is a great quote from Ayn Rand that I will just read the highlights to you. But she says, productive work is a consciously chosen pursuit of a productive career, utilizing the fullest and most purposeful use of your mind. Okay, so again, the brain is the greatest creation in the universe, I believe, and we all have one. And so let's use it to our fullest capacity to serve ourselves and live our best lives, but also to serve others and help them achieve optimal health so they can serve or live their best lives. And then lastly, Voltaire, why are we here, right? Because the conventional medical model is failing chronic disease patients and it's not built for it, like I said. Well, Voltaire said, doctors put drugs of which they know little into bodies of which they know less for diseases of which they know nothing at all. Okay, so again, conventional medicine is excellent if I break my arm or if I'm in a car crash or I need my life saved. But once they've stabilized me and my life is saved, to stay in that model and get healthy is not a good strategy. I need to go find a functional medicine clinician to achieve optimal health after that. And so again, it's a question of, are we matching the paradigm with the needs of the person? If I have the broken arm, the proper paradigm is acute care. If I have type 2 diabetes, the proper paradigm is functional medicine. Or if I have rheumatoid arthritis, the proper paradigm is functional medicine. I mentioned this in my book, but this is a paper from 2006 that said medical care in the United States is uniformly mediocre. And the results of the paper stated, overall, participants in the study received, we'll call it 55% of recommended care. All right, so this begins to snowball negatively for our patients and for the population. If medical care in the US is uniformly mediocre, and then the patient going to get that mediocre care is only getting a mediocre level or 55% of the recommended care, that's terrible care. Okay, that's a terrible experience, and those patients probably are not getting significantly better or helped. And so we need to be better than this. And this was 2006. Well, maybe it's improved since then. Let's see. Here's a paper from April 2022 titled Most Healthcare Interventions Tested in Cochrane Reviews Are Not Effective According to High Quality Evidence. This is the Journal of Clinical Epidemiology. And if you're familiar with Cochrane Reviews, that is a body, a research body that looks at anything, whether you're looking at, you might look at a vaccine, or you might look at a rehab maneuver or a surgery, and they're testing it to see how much high quality evidence is there for this therapy or for this strategy. And they are kind of the top in terms of, if Cochrane Review says there's high quality evidence and this is a good thing, then people love to parrot that. If they say it's bad, then people believe, hey, there's not great evidence behind this. So they looked at this, they run this study, and they looked at over 1,500 healthcare interventions to see, well, how much of conventional healthcare has high quality evidence behind it. And you can see down in the highlights, quote, most interventions, 94% of that 1,567 interventions studied were not supported by high quality evidence. Potential harms of healthcare interventions were measured more rarely than benefits. Okay, so that means in the research there's a bias towards showing benefit, right? And if most of the research is pharmaceutical funded and on pharmaceutical products, of course they're not going to parrot research that says this product doesn't work and it hurts people, right? But we need to be aware as clinicians that, as a chiropractor, I could be called a quack by other doctors, right? And there's no evidence behind what you do and blah, blah, blah. Well, of the 1,567 interventions that conventional medicine does, 94% of them don't have high quality evidence. So, we're not quacks. We're all trying to stumble forward into that kingdom of God, find the best care and help people the most. And so we need to, if we're not medical doctors, we need to not have an inferiority complex. And we need to know that it's called practice, and we're all learning and we're all seeking to provide the best quality of care and provide the best evidence for what we're doing. And so if a patient was failed by conventional medicine, if they were failed by Mayo Clinic or Cleveland Clinic, it doesn't mean they got the best medicine and that they can't be helped. It means that, they got the same poor quality that everyone else did. And so you, as a functional medicine clinician, using non-standard testing or outside the box testing may be able to help them in a different way. Why? what's the secret sauce for functional medicine? Right here in this picture. Okay, here's conventional medicine's paradigm. It's a disease-based paradigm that's focused on diagnosis. Okay, it's a black and white system. White would be you're healthy, there's nothing to diagnose. Black is you're diagnosable, you've got this named disease. Okay, if you're someone with a chronic disease, you don't cleanly fit the black or white paradigm. So you have to suffer in conventional medicine until you fit black, and then they can finally say, oh, your joint pain and inflammation that you've had for 7 years and has been wrecking your quality of life is actually rheumatoid arthritis. We can say that now because you fit the changes on the x-ray and serologically that we've been looking for. And you're like, yeah, I've been saying that for 4 years that I suspect that. Why did I have to suffer this long? Right? Because that model is focused on until we have a diagnosis, we can't do, we don't have a algorithm to push you down to treat it. And we might not be able to bill for it. But patients deserve better than that. And so, reality is the final arbiter. And I think everyone realizes that there's more than black and white. There's actually white and about 50 shades of gray and then black, right? And these images are from my book and it's discussed in my book. But as functional medicine practitioners and clinicians and doctors, what we're doing is we're working in the gray area 99% of the time, okay? Or maybe a little less than that because patients do come in with diagnoses. But oftentimes, a lot of our patients that we see have chronic symptoms without a label. They've seen tens of doctors and suffered for, 10 plus years sometimes and haven't been given a label and they're frustrated. And the reason for that is because they're in the gray area. And so they're not going to get that label until they're black, but we can help them anywhere on this spectrum. And the sooner or lighter gray we find them, the easier and the higher chances we have to prevent them from ever reaching that diagnosis, and the better shot we have at helping them reach optimal health. So from an autoimmune disease perspective, we need to understand that autoimmune diseases fit diagnostic criteria from a medical standpoint. So you've got a DSM diagnosis code. You have to fit these criteria to be able to use that code and bill for that. Okay, but again, that's long term. Okay, that's way down here in the black area. But we can catch patients sooner and earlier. So the healthy patients that are all white, we don't see unless they're being proactive, which there's more of those coming out of the woodwork that, hey, I want to be tested and know, even though I don't have symptoms, am I as healthy as I feel? That's good because you all know out there that feeling isn't function. You could have cancer or heart disease developing even though you feel great, all right? But from an autoimmune context, a patient that is light gray can have positive antibodies but be asymptomatic or be very low symptoms. Then over time, they'll have positive antibodies and begin to develop more signs and symptoms. And these are probably the majority of the patients we see. They don't have a diagnosis, but they're suffering. They've got brain fog, they've got constipation, they've got pain, they've got headaches, they've got food reactions, they've got diarrhea, constipation, bloating, SIBO, all kinds of stuff, okay? These are darker gray people. And, if they suffer long enough and don't find us, ultimately they'll get a diagnosis, but we want to find them, again, as early in the gray spectrum as we can so we can turn them around more easily. Yes, if they have a diagnosis, we can still turn them around, but it's easier to make a stop with your back at the 50-yard line than it is with your back at the goal line, right? So I hope this makes sense to you and maybe it was an aha moment for you that we are the masters of gray and the nuance in there. And so the earlier we can figure out where they are on this spectrum, the better. And the way to do that is with testing. So again, how do we determine if an autoimmune process or disease is occurring? How do we track if our clinical actions are promoting longevity? We do that with testing. And that is how Vibrant Wellness is serving us as clinicians. They're providing top level innovative testing to help us pull back the veil on patients and understand, yes, even though your CRP is negative with your medical doctor, you've got all these other markers that are positive that are not run standard by conventional medicine. And so they're going to miss you until you're so bad that your CRP is high. Okay. We can help this person years before that happens by running tests. And the mantra needs to be test, don't guess. Test, don't guess. Test, don't guess, right? Get that tattooed on your forehead or your low back or, your bicep, wherever you want to show it off. But test, don't guess is the mantra. And so we're going to look at tests that Vibrant Wellness provides today. I'm going to focus largely on the NeuroZoomer Plus, but we've got other tests in here as well. And Vibrant Wellness provides this suite of tests. Vibrant America also provides standard serum testing like what LabCorp runs. So through Vibrant, you can run the whole suite of what you need to do. You can run these specialty tests and you can run the LabCorp style tests so that the patient's only going to one place, being stuck one time, and you're getting all the info you need. Lastly, before we jump into patient cases here, this is an image from my book. And as I say up here at the top, understanding this image can change your life, your practice, and your patients. And the reason for this is, at least for me clinically, my bias is immunology. And the reason I have that bias is because everything we do has the potential to positively or negatively impact our immune system. And so if we don't understand the immune system well, we're not going to help complex cases as well as we could. So understanding this picture will help you understand the immune system, understand what you want to test, why you want to test, understand what supplements you should give and what lifestyle strategies you should recommend. This picture is the Rosetta Stone, okay, for immunology, at least 101, 201 levels. Okay, I don't have time to go into it a ton today, but grab the book. You can learn more about it. Watch my YouTube channel. There's lots of places to learn immunology. So let's dive into case. This is case number 1, and this is Jennifer. Jennifer has multiple sclerosis. Okay, she came to me from Ohio because she had 5 months straight previous to coming to see me where she could not read, she could not drive, she couldn't see the wick of a candle because she had a uveitis flare in her left eye. So she had uveitis, she had left eye pain, and she couldn't see, read, drive. Okay, she had seen her neuro-ophthalmologist, she'd seen her vitreoretinologist, and all they wanted to do was inject her eyeball to help take the pain away. I don't know about you, but I'm not raising my hand to get in line for an eyeball injection. And neither was she. So her primary symptoms were uveitis, flaring for 5 months. Okay, she has relapsing remitting multiple sclerosis since 2010, and that was diagnosed by IgG bands in her CSF fluid. She's obese. Okay, she came to me at 5'2", 236 pounds, and she had acid reflux, which is part of the metabolic dysfunction of her case. Okay, so when we had our consultation before she decided to come down from Ohio, which her husband drove her from because she couldn't drive, she said, I can't drive or read because of vision issues. My neuro-ophthalmologist can't find anything wrong and recommends toxic meds delivered by needle to the eye. Not great. Okay, so my neuro-ophthalmologist can't find anything wrong. Now, we don't want to judge people, right? But just sitting here looking at the information in front of you, would you say there's nothing wrong with this person? No, right? She's obese. She's 5'2", 236 pounds. Okay, so do you think that her metabolic state is playing a role in her neuroautoimmune disease? Say yes, because you'd be right. All right. And so what does the brain need? Multiple sclerosis is a neuroautoimmune disease. It's in the brain. Okay. So what does the brain need to function? Brain needs glucose. Well, if a person is obese and insulin resistant, how efficiently is she delivering glucose to her neurons? Not well. Okay. Brain also needs oxygen. So iron matters because iron carries oxygen to deliver that to the brain. Brain needs stimulation, which is movement, learning, novelty, exercise, things like that. Okay, so if she's obese, she may not be getting the stimulation she needs. If she's insulin resistant, she's probably not getting the glucose she needs. And we'll have to check her iron status to learn about the oxygenation. So let's dive into that. All right, another important point was before she came to see me, she was in a Walls protocol study. Okay, if you're not familiar with Walls protocol, Dr. Terry Walls had multiple sclerosis herself. She was wheelchair bound, and she changed her diet to a predominantly vegetable-based diet. And she's walking again and touring the country and doing research on that diet because she's walking. She's helped a lot of MS patients. Well, Jennifer went through her study and was not helped by it. So chapter 9 of my book is There's No Perfect Diet. Okay. The Walls protocol diet is great for some people. It'll hurt some people. A paleo diet is great for some people. It'll hurt some people. Keto diet, carnivore diet, all of them. Okay. So when you have a person in front of you, the question is, what's the perfect diet for this person's physiology right now? And understand that that perfect diet may be different for that person 2 years from now than it is today. So again, we want to make it individualized and specific so we can get the best result rather than hear MS and just say, oh, everyone gets a Walls protocol. And you'll understand more about why it didn't work for her in a little bit. Again, she came to me in March 2020, hadn't driven since November 2019 because she couldn't see out of her left eye. Longest flare she'd ever had. Vitreoretinal specialist wants to give her eye injections. Lab high 9 CSF oligoclonal bands in 2012. And again, that's what diagnosed the MS for her. Heat, diet, and sleep disturbance exacerbate her symptoms. If you've had experience working with MS patients, you know that that's not uncommon. Initial testing. So again, here's the Vibrant America blood work that you can also pair with their specialty testing. So what we had first here, her hemoglobin A1C was a 6.0. Okay, so she was pre-diabetic. Her ferritin was lab low at 11. Okay, so ferritin is the iron savings account in your body. It's the best marker for stored iron in your liver. So brain needs glucose, brain needs oxygen. How's she doing? Not delivering glucose well, okay, due to insulin resistance. Her HOMA score is 2.53. You can see there above 2 is insulin resistance. So she's insulin resistant and she's iron deficient. So she's not delivering oxygen well due to lack of iron carrying capacity, okay? So right away, brain's not going to do well. You can put her on a Walls protocol. You can give her the best anti-inflammatory brain nutrients, but if you don't improve her diet and you don't improve her iron status, her MS isn't going to get better. Her insulin and her C-peptide were both functionally high. Okay, so again, supporting the insulin resistance and the high HOMA score. Jennifer had lab high homocysteine at 14. Homocysteine blows up neurons. It drives neuroexcitotoxicity. It damages vasculature in the heart as well. Okay, the research on neurodegenerative diseases says that any homocysteine above 11 is blowing up neurons. The research on MS says any homocysteine above 10 is blowing up neurons. She's got a 14. Okay, neuro-ophthalmologist says, there's nothing we can do. There's nothing wrong with her. How about you run a homocysteine, neuro-ophthalmologist? Your name suggests you're interested in the nervous system. If homocysteine's high and you're blowing up neurons, the eye's not going to improve. Her red blood cell magnesium is borderline lab low. Magnesium plugs the NMDA receptor, which drives neuroexcitotoxicity. Okay, homocysteine will drive the NMDA receptor. So we need her magnesium to be optimal to help plug those NMDA receptors, reduce the excitotoxicity and the neuron death, reduce the flare in her case. You want to run red blood cell magnesium. That's the best form to look at. The serum magnesium is cheap, but that's only representative of 1% of your magnesium stores in your body, so you don't have clear information there. Her vitamin D was functionally low. We need vitamin D, antiviral, anti-inflammatory, immune system modulating, bone health, muscle health, dopamine signaling, gut barrier, antimicrobial peptides, all kinds of functions for vitamin D. I want her at least 50, goal would be 70. Her CRP, high sensitivity CRP, elevated. Lab high TGF beta, high. Okay, we talked about earlier understanding the nervous system the immune system helps you understand patients. Well, CRP is representative of interleukin 6. TGF beta represents TGF beta. If she's got tons of CRP and TGF beta in her inside her body, that's going to drive this naive T cell towards a Th17 differentiation phenotype. Th17 cells drive the tissue damage in autoimmune disease. So we can see right here with testing, if she's got high IL-6, which CRP is a surrogate marker for, and high TGF beta, she's driving tissue damage in her autoimmune disease. Might that be part of her uveitis flare? Boom, that's how you can use blood work to see what's her immune phenotype. Okay, so we go back there and we can say, well, those two high, it's going to be key to get those down and observe, does her vision improve, does her flare drop? Okay, and then my head is blocking, the other ones there. If you can move my head up, there we go, thank you. She had lab high myeloperoxidase. Myeloperoxidase, toxic to neurons, toxic to heart, increased risk of cancer and autoimmune disease. You want to be below 470 for heart, for reducing cardiovascular risk. I like to see people below 300, so they've got margin there. So specific to MS, high MPO drives neuron damage. She's, 3-4 times too high. She had lab high gliadin IgA antibodies showing that her mucosal immune system is gluten sensitive. Gluten cross reacts with the brain. We don't want to keep eating things that are going to blow up her neurons. And then I looked for Epstein-Barr in her. Why? It was negative, but we want to look because in 2022, a study came out from the Department of Defense showing that Epstein-Barr virus is causally associated with multiple sclerosis. It's a causal driver of MS now. It's not just correlated anymore. That DOD study showed it's a causal factor. So again, with MS, I want to cover the bases and say, okay, is Epstein-Barr infection or reactivation at play in her case? In her case, it wasn't. So that was the blood work. We also ran a lectin zoomer on Jennifer. Why? Because lectins, especially aquaporins, cross-react with the aquaporin 4 channel in the brain. The aquaporin 4 channel is a protein channel in the blood-brain barrier that lets water in and out, okay? And so if you've got antibodies to that, that can break down the blood-brain barrier, drive neuroinflammation. Well, we tested her and look, she's positive, okay, to lentils and potatoes, okay? Other aquaporins, spinach, soy, tomatoes, okay? Why do you think she didn't do well on the Walls protocol? Because all they eat is the veggies. And a lot of those, Dr. Walls loves spinach. Spinach is a big time aquaporin 4 cross-reactive food. So Jennifer eating that, or someone who's got cross-reactivity there, they won't do well with MS eating that food. So she was potato and lentil. She's got aquaporin 4 cross-reactivity. Eating those things could flare her disease. So again, what's the right diet for this person right now? We also ran the NeuroZoomer Plus. This is my favorite test. I'm biased because, I like immunology and I like, neuro autoimmune issues. So this is a wonderful test by Vibrant. Hats off to them. I love it. It's about 50 markers looking at autoimmune, looking at antibodies targets to the nervous system. Okay. And so in looking at hers, she was positive for 2 things specific to MS that were never run by conventional medicine. Remember, she was diagnosed by oligoclonal bands in her CSF fluid in 2012. No one had ever run antibodies that are associated with MS, like myelin basic protein and myelin oligodendrocyte glycoprotein. So MBP and MOG antibodies. She was positive for both. Okay, so she's got autoimmune targets to the proteins involved in MS. There's no autoimmunity there. Those are moderately high. But if we look at the S100B antibodies, those are lab high, like high, okay? All 3 are evidence that the immune system is shooting at self. In her case, shooting at brain. S100B is a blood-brain barrier protein. So when you are creating antibodies to this, you're creating antibodies to your blood-brain barrier. So you have an autoimmune attack there. You've got autoimmune leaky brain. Okay, leaky brain is going to drive neuroinflammation. Neuroinflammation will drive whatever your weak link is. In her case, it's going to flare autoimmunity from an MS uveitis perspective. So this is big for us to see. Yes, there is autoimmune attack of her brain. So the neurologists have no answer, right? We can't find anything to do. Just stick this needle in your eye. Otherwise, like, we don't know what to do. Test, don't guess. Test, don't guess. Chant it with me, right? Test, don't guess. So there's plenty to do. What Vibrant helped us see was that this patient is insulin resistant. If you couldn't tell that, again, we don't want to judge, but sometimes the cover does represent what's underneath. She's iron deficient. Brain needs glucose and oxygen. Right now, she's not doing well. She has hyperhomocystinemia, homocysteine of 14. She's blowing up neurons. You think methylation matters there, or B vitamin status? Absolutely. Liver function? Absolutely. She's gluten sensitive. So every time she eats, she could be cross-reacting with her brain. She's got potential aquaporin 4 cross-reactivity through the potatoes, okay? Could be blowing up brain that way. And then she's got that Th17 immune bias. So what do? We implement individualized and specific care, and within 3 weeks, she's driving and reading again. Boom, okay? Individualized and specific is the secret sauce. If you watch this today, when you walk away, I want you chanting 2 things. Test, don't guess. Test, don't guess. And individualized and specific. Individualized and specific, okay? And so after 5 months of the worst flare she's ever had, not being able to read, not being able to drive, we get individualized and specific for her. We address what showed up under her hood. And within 3 weeks, she's driving and reading again. Boom. You can do this, okay? Just because you don't have a fancy title like neuro-ophthalmologist doesn't mean you're less than. Fervent desire to never-endingly improve our understanding of physiology and testing, and implementing that saves lives. 3 weeks, she's driving and reading again. I work in 3-month blocks typically. I retest at 6 weeks, a smaller midterm exam of whatever was positive initially. And then at the 12 weeks, we do a more apples to apples test to see how they've improved. Okay, so this is the 6-week midterm questionnaire I send. And so you can see here, her energy was 75% better. Her digestive complaints, 75% better. Her mental clarity, some percent better. My head's in the way there. I believe it was 50% better mental clarity, 75% less pain, okay? Sleeping better, 75% better attitude. You think? If you can't read or drive and you can read or drive again, you think that person's gonna have a better attitude? Absolutely. So that was 6 weeks. Also at 6 weeks, she sent me this email. Dr. Bartemus, thank you. I forgot to mention that I had a recheck appointment with my vitreoretinal specialist on Friday. He was very impressed that I was able to start driving again after 3.5 weeks on this program. I could also read 1 line further down with my left eye than the last time. He told me to keep doing whatever I was doing. My eye looked terrific, and I definitely didn't need another injection, which before all of this may have been a strong possibility. He also said he would inform my neurologist of my great improvement. I hope this changes her mindset about what I'm doing. Okay, so if you're watching this, you've probably had an experience like this, and you know the mindsets are hard to change out there, but you're not less than. You're winning where they didn't. So that's great. Just 6 weeks after 5 months of suffering, okay? We don't need to sign people up for year-long plans. It doesn't take that long to heal. If you can find out what's wrong and address it successfully, my job's figured out, your job's go do. If we both do our job, you heal fast, you get healthier quicker, okay? So as the doctor, if we're nailing it, we don't need 12 months, okay? We should be able to do it in 3 months or less, most cases. 3-month retest. Okay, her lab low ferritin had improved to functionally low. Still some work to do there, but improved. Her A1C down functionally high from lab high. Much better A1C. Look at this, much better average insulin. Her HOMA score dropped down in below insulin resistant level. So she's reversed insulin resistance. Her homocysteine, 3.3 point drop. That's a significant step in the right direction. I want her to get to 7, okay? Research says with every 5-point drop in homocysteine, you have up to 50% reduction in death from all causes. So big win there. Her red blood cell magnesium is now optimal. So she's plugging those NMDA receptors. Her vitamin D, now optimal. Her CRP had come down a little bit, so still a little work to do there. Her TGF-beta is now optimal. So reducing the TGF-beta helps swing that pendulum of immune phenotype away from Th17. Her MPO is down 50%, huge for reducing inflammation in MS and uveitis. Again, our goal is 300, so big time change there. And then her previously lab high gliadin antibodies are now negative. Does that mean she can eat gluten again? Please shout no. It means she's done a great job avoiding it, okay? So she needs to continue avoiding it. So this is a testimonial video you can see on my YouTube channel at the 3-month mark where she's saying how great she's doing, okay? With her, we actually did another 3 months because she was significantly improved, but there were still things that both she and I wanted to see improve more. Her homocysteine, her iron, her CRP, her MPO. Okay, so we kept going. And here's a timeline to see her changes here. So her first testimonial video, right away when she could see after 3 weeks. Here it is at the end of 3 months. And then here's one even further down, like a year later. And the reason I put this on is because look at her changes. Remember when the vitreoretinologist said there was nothing they could do for her, there wasn't anything wrong, and she was obese and insulin resistant? Do you think changing her body weight, body composition, insulin sensitivity played any role in her being able to see and drive again and live optimal? Yes, there's something you can do. Be Batman, okay? Be Batman. Here's February 2021. Hi, Dr. B. My vitreoretinologist at my 8-month checkup said my eyes look crystal clear, no inflammation. He knows he can't see the potentially permanent damage from MS, but keep up the good work, he said. Okay, so that's February 2021. Here's September 2021. Great news. I saw my vitreoretinologist today, and he said my eyes look the best they have since he met me. Okay, and we're no longer working together at this point. We'd finished her second 3 months. High five, great job, spread your wings. Discipline's the only magic bullet. Keep living the lifestyle. So she's doing it. And look, my eyes are the best they've been since he's met me. Everything they did today showed great improvement. He actually said I'm very boring, which is great because I've been too interesting for too long. Okay, that's September 2021. Here's July 2022, so almost a year later. Good morning, Dr. B. I know you're on vacation, but I wanted to tell you I received an excellent and boring report from my vitreoretinal specialist this morning. He told me to keep doing what I'm doing and not doing what I'm not doing. I also got to make an appointment for a year out, which the receptionist told me is unheard of for his patients. Thank you for all you've done. So again, this isn't to pump me up. It's to show you that you can take the same principles I did. If you're learning the physiology and understand it, you can run the tests. You can put the piece together for her, show her what she needs to do. If she implements it, she can do this, and your patients can do this. So don't think you're less than. You're not. You are Batman. Be Batman. Let's look at Ava. Ava is at this time was a 5-year-old girl with autism. Okay, she was diagnosed with autism at age 3. She'd had chronic constipation since she was 18 months old. She was diagnosed with OCD at age 5. Ava has autism. She's been seeing PTs and OTs and speech therapists and all of that stuff. Why? Well, because she has oral motor delay, developmental delay, speech delay, sensory processing disorder, so that blenders and boiling water make her scream. And she was put on Nexium at age 6 months. Proton pump inhibitor, how's that going to help her GI, right? So you might look at this and be like, man, I don't know how to work with motor delay or developmental delay or speech delay. Okay. You could say, I could tell you, just forget about that. You don't need to know that because she's seen specialists that do that and she's still not getting better. So what you need to do is look under the hood and say metabolically and immunologically, are there things wrong that I could optimize to make her case better? And absolutely there are. Okay, but let's just dive into this. If you know some neurology or some functional neurology, you can help her even more, or that can help you, understand why she's not getting better. Oral motor delay. She doesn't chew her food. She's never eaten, okay? Her mom's a pharmacist, okay? Her mom has been blending her food her whole life because she can't chew it. Well, guess what? If you can't latch on as an infant and then you don't progress to eating whole food, what are you not doing? You're not chewing. Well, chewing is controlled by 3 cranial nerves, 9, 10, 12, okay? Those cranial nerves exist in a homologous column in the brainstem, meaning if you fire one, you're firing them all. Well, firing the brainstem fires the cerebellum. Firing the cerebellum fires the cortex. So chewing is going to lead to brain development, okay? If she's not chewing her food, she's not driving brain development, and guess what? Oh my gosh, she has developmental delay. You think? She never learned how to chew, okay? She has speech delay. You think? If you can't chew, you're probably not going to speak well, okay? And if you're speaking or not speaking, again, you're not driving jaw motion and firing that brainstem off. Sensory processing disorder, again, is just part of not hitting milestones. So as the clinician, you can test some primitive reflexes. You can understand the functional neurology and say, hey, OT, PT, you can go back and work on speech and stuff, but focus on getting her eating and chewing first, okay? So she can't chew her food. We have to blend all her food, but running the blender makes her scream, so how's this feel for the parent? She's having tantrums and OCD, and you're trying to feed her, but the mechanism you have to use to blend up her food also drives her nuts, which makes your day hard. So you can see how frustrating it can be. And I'm sure you've had autistic patients in your practice where, you may have experienced it in your practice. So the mom's a pharmacist. She came to me just for hope to get help from the constipation. She didn't even think we could help her with the autism or OCD. She's just like, hey, if you can get her pooping, I'm happy. So deep down, I'm like, I can get you more than that. Okay, I'm confident I can. So even with those things, Ava's brilliant. Okay, she began to read fluently at age 3. She could play the piano just by ear. You pull up a song on your phone and she'll sit down and play it. Okay, why is this important? She's possible. She's not impossible. She's possible. Okay, mom said, I just want her to poop. And as a clinician, I don't want to get hung up in, getting her to poop is the only goal we have, because this girl might be the next Beethoven. Okay, I want more for her than just poop or eliminating constipation. I want her to reach optimal. So if we can affect her nervous system and her autism, we could change her life and maybe unleash the next great artist on the world, right? What supplements was she taking when she came in? She's taking a bunch of good stuff. You Google autism and this stuff might come up. Sulforaphane, CoQ10, methylated Bs, Kitty Reg and Pottywise and Pedialex to help with constipation, elderberry, raw probiotics, kids multi, kids brain boost. Okay, all of us doctors on this call would agree that's a good list of stuff, but why wasn't it helping her? Okay, because there's, that's a great list of stuff for a Google avatar of an autistic patient that doesn't exist. Okay, we're not treating an avatar of autism. In this case, we're treating Ava. So we need to know in Ava's case, what's going on under the hood that we need to fix. So Vibrant Wellness to the rescue. We are Batman. We need to use our tools to figure out how to crack this case. And so I ordered blood work. One problem. She's autistic. She won't let us stab her. Okay, so we can't get the blood draw because she won't let us perform the phlebotomy. But the good thing about Vibrant Wellness is they wear capes and they have finger prick testing. So we could do that on her. So we got finger prick testing for micronutrient panel, for the Neuro Plus, and we got a stool test on her. And that's plenty to start with. So here's her micronutrient test. And you can see the issues, okay? Vitamin B2, lab low. You need vitamin B2 to make glutathione. Glutathione is the body's master antioxidant. Big time role in immune issues, okay? She also is lab low in selenium. Selenium's a cofactor, functionally low in selenium. That's a cofactor for production of glutathione. That's antiviral, a nutrient used for all kinds of things. Her glutamine's lab low. You need glutamine, okay? Her glutamine's lab low and her manganese are both lab low. manganese is a cofactor for an enzyme that will convert glutamate to glutamine. Okay, well, glutamate is your gas pedal. Okay, glutamate is the gas pedal neurotransmitter in the brain, and you can watch this video on my YouTube channel if you like. But glutamate's a gas pedal. Glutamate's neuroexcitatory. It'll set off NMDA receptors, drive neuroinflammation, drive autism symptoms. Okay, so one way to lower your glutamate load is to have enough manganese to run the enzyme that will take glutamate and convert it to glutamine, and that will lower your glutamate load. Another nutrient you need that she doesn't have, lab low or functionally low B6 here, is B6. And you can use B6 through an enzyme called GAD65 to take glutamate and convert it to GABA, take the gas pedal and convert it to the brake pedal. GABA is our anti-anxiety neurotransmitter. Calm down, motor down, go to sleep, don't have tantrums, okay? So if you have low B6, which is the rate limiting step for the GAD65 enzyme, meaning if poor B6 doesn't go forward efficiently. If you have low B6, low iron and or low magnesium, you don't get GABA, you get backed up glutamate, more excitotoxicity, more autism, more OCD, more neuroinflammatory symptoms. Okay, so here's how nutrient status can impact her case. And then her choline is functionally low. Why does that matter? Well, the vagus nerve is cholinergic. You need acetylcholine for the vagus nerve to work properly. She's not chewing her food, so she's not driving vagal function very well. What if she could chew? If she could chew, but she's got poor choline status, the vagus nerve still might not function as optimally as you want it to. So we need to have neurologic input to the vagus. We need metabolic input to the vagus, in this case, proper choline levels, so that neurology can happen. So lots you can learn here from the nutrient panel. The neurozoomer we ran, and she had positive anti-dopamine receptor 1 antibodies, positive HHV6 antibodies, okay? Dopamine receptor 1 antibodies are involved in driving the neuropsychiatric symptoms of, say, pandas, okay? Or, you know, in this case, not pandas, but autism. It can drive OCD, it can drive anxiety, drive the neuropsychiatric symptoms. So she's lab high there. That's playing a role. We've got immune attack of the dopamine receptor in the brain, okay? HHV6 antibodies high, history of HHV6, which is a human herpes family virus that lives in the nervous system forever once you've contracted it. So if it reactivates, that can drive inflammation that way. And then I'm getting super nuanced here. Her NMDA receptor antibodies were technically negative, but you can see the IgMs are hugging the potentially positive moderately line. And if those were to tip over, people with NMDA receptor antibodies, if they develop NMDA encephalitis, don't live long. So that's something I wanted to pay attention to, and hopefully we can, you know, prevent that from tipping over. And then that's important because glutamate stimulates the NMDA receptor, and with her poor manganese level, she's not shunting glutamate down to glutamine to lower that level, and with her poor B6, she's not efficiently shunting it to GABA. So the more glutamate's around, the more likely she's stimulating NMDA and driving symptoms. Her stool test, she had high H. pylori, high strep, high staph, and deficient secretory IgA. Here's a study. I believe this is from 2019. Sorry on that, but you can Google the title and you'll find it. But this was a study on mice looking at an MS model in mice, and they found that secretory IgA from the gut travels to the brain to confer anti-inflammatory benefit. Right? Gut, brain, gut loops. So here's a gut-brain axis trigger. If her gut's a mess, if she has deficient secretory IgA, she's missing a big-time anti-inflammatory stimulus for the brain, okay? Because the study's showing it can travel to the brain and put fires out. Here's why her gut matters. Do you think the OT is looking at her gut? You think the PT is looking at her gut? You think the other, you know, autism quote-unquote specialists are doing that? No. You think they're looking at her vagus nerve? Not much. So these are ways we can help. We need to see her as AVA, not as autism, because autism protocol leaves out secretory IgA, leaves out primitive reflexes and homologous columns in the brainstem. We need to be Batman, okay? not Commissioner Gordon. All right, here's 2 more studies showing quickly just the brain-gut axis and autism. So this one here was looking at C. diff infection. So presence of C. diff and a lack of probiotics can drive autism through gut-brain axis mechanisms. This one has shown the bidirectional communication between the gut microbiota and short-chain fatty acids and impact on the brain and autism. So again, don't look at autism as only neuropsychiatric, it's whole body. We have to figure out which parts of each patient's body are involved. So here's Ava. I said earlier, I work in 3-month blocks, but I don't pigeonhole myself to that. In her case, I thought we only need 9 weeks. So we did a 9-week plan with her, and her mom wrote this Google review. I went to Dr. Bartemus for my autistic daughter who had chronic constipation. Her constipation was severe, so severe that we had to take her to urgent care for severe pain. We went to several pediatricians who recommended a medication that caused her to have loose stool all day and soil herself. Okay, so this is a mom dealing with a constipated autistic kid. Now you're going to add on the kid's soiling herself because of medication you gave her. That's making mom's life harder. Okay, I went to Dr. Bartemus mainly for constipation to find that he not only dug into the cause of constipation, but also her autism and neurological behaviors and their cause. My doctor's in her 2nd month of treatment, all natural, no side effects, and her constipation is gone completely. Her behavior, tantrums, anxiety, OCD is improving tremendously. I can't recommend Dr. Bartemus enough. And so I'm not showing you this to toot my own horn. I'm showing you this to say that we did a 9-week plan. This was 8 weeks in, and the 9-week plan had 3 phases to it. Because mom didn't want to load a bunch of supplements into Ava right away, by 8 weeks, she'd only still done phase 1. Phase 1 was focused mostly on addressing that micronutrient panel and some other basics. So again, she hadn't even done all the care I wanted her to do yet, and she got these results, okay? And mom emailed me separately and said the OT and the PT had commented on how much better she's doing, and they're going to refer all their patients to me. And it's like, cool, if they do, that's awesome. But the reason I like that is because when other practitioners recognize your outcomes, that's awesome. So again, we want to remember that Ava is possible. Don't plug her into an autism protocol. Look under her hood. Use your Batman tools to figure out what matters in this individual's case. Individualized and specific. Individualized and specific. Last case here. I know I'm pushing time, but I think this one will be real interesting for you guys. Pandas. Ethan. Ethan's 28 years old when he came to see me. He came from Wisconsin. Okay. He'd been diagnosed in 2009 with pandas. He developed antibiotic-induced IBS at 2013 after taking so many antibiotics to try and deal with the pandas. He's had asthma lifelong. He had C. diff and candida in 2017. He was using conventional treatment for the pandas, rituximab, 1,000 milligrams, and plasmapheresis weekly to monthly, depending on his symptoms. Okay, so rituximab is a CD20 monoclonal antibody. It's destroying the cells that promote antibody production so that those antibodies don't tag his brain and drive symptoms in him. The plasmapheresis, he goes in, they take out his plasma, spin it down, put it back in. Okay, that's not very cheap and it's not very comfortable. So what if we could figure out a natural way to help this guy? Of extreme interest to me, which was didn't even earn an asterisk in his medical record, okay, was that he had lab high GAD65 antibodies in 2012 and 2018. Why might that matter? Okay, why might GAD65 matter? Where have we heard that before? Right up here. Boom. GAD65 is the enzyme that drives the conversion of glutamate to GABA. He has tested twice to antibodies against that enzyme. So he could have autoimmune OCD and autoimmune anxiety due to the GAD65 antibodies. And that could be masquerading as pandas, potentially in his case. Let's see if it was. So we ran labs. And what we saw on the blood work is his immune system was deficient and he's inflamed. Okay. His vitamin D was deficient. Again, why might that matter? Well, we need D for a balanced immune system. D is antiviral. These produces antimicrobial peptides or antibacterials, specifically LL37, also known as cathelicidin. If this is a panda's case and we have recurrent strep infection, which is bacterial, and we're D deficient, not making the antimicrobial peptides that our mucosal barriers need, might strep gain more real estate and create more problems than it would if his vitamin D status and immune system were optimal? Yes. Okay. His total IgM status is lab low. That's going to be important here in a minute. And the Neurozoomer Plus showed positives to a bunch of things we'll talk about some other day, but the ones that are relevant to us for this context is he had the S100 antibodies. So he's got blood-brain barrier target. He had anti-glucose regulated protein 78. That's another blood-brain barrier target. So he's got antibodies to 2 blood-brain barrier targets. Okay. So if you're destroying the blood-brain barrier, that drives neuroinflammation. That could worsen your PANDA symptoms or your OCD or whatever. Now, viewers out there, take a look at the screen and tell me what's missing. What's the question mark there for? It's a Neurozoomer Plus test. What was I looking for in this guy? He's a PANDAS patient. Where are the PANDAS antibodies? None there, no positives, right? Does he have PANDAS? Or is he undergoing plasmapheresis and taking rituximab for something that doesn't exist? Ooh, that'd be maybe a malpractice case. So, all right. This is supposed to be animated, but just hang with me. Remember, his IgM was lab low. Neurozoomer Plus is running antibodies from an IgM standpoint and an IgG and IgA standpoint. To run antibody testing, to get a specific IgM result, say to anti-CV2 antibodies, you have to have enough total IgM made in the body to give a specific result. Does that make sense? So if your total IgM is lab low, then all your negative specific IgM test results could potentially harbor false negatives, right? If you don't have enough to show me a general positive, how can you show me a specific one? So here's where math comes in. We can do math to take his low level and scale it and say, if he had normal levels of total IgM, what would his IgM specific antibodies scale to? And that can pull back the veil and show us something. And in his case, it does. Remember, we're looking for PANDAS antibodies. So tubulin antibodies, dopamine 1, dopamine 2, asioganglicide, calcium calmodulin kinase 2. Those are the ones involved in PANDAS. So if we take his negative IgM and we scale it through this math here, we can see that his 3.5 IgM antitubulin antibody actually becomes positive at 24.39. If we scale his dopamine 1, his 4.4 becomes positive at 30.6. His GABA receptor antibody at 8.5 negative, scaled becomes positive at 60. Okay, so now with the power of math and scaling, we can see that in front of us he has 2 positive target sites, or 2 positives for antibodies to targets in PANDAS cases, tubulin and dopamine receptor 1. And remember, Ava had dopamine receptor 1 as well. That drives the neuropsychiatric symptoms like OCD in PANDAS. GABA receptors, okay? He's got antibodies to GAD65, remember? That's the enzyme that converts glutamate to GABA. So that's one stick in the spokes of him being able to produce GABA and not have OCD and not have anxiety and calm down. Well, if he's got lab high antibodies to his GABA receptors, say he went to Vitamin Shop and he was like, hey, I have autoimmunity to GAD65. I don't produce GABA well, so I'm going to go buy a GABA supplement. He takes the GABA supplement, and that supplement, that GABA, has to bind onto that GABA receptor to have the physiologic response. Well, if he's got antibodies to his GABA receptor, adding substrate to ping that receptor wakes up the antibodies that see that receptor functioning, right? It's kind of like you're adding substrate or teasing them. So that could flare. Taking GABA to reduce his OCD and anxiety could cause more OCD and anxiety. Okay, so it's wild out there. The immunology is so cool, isn't it? So this is cool to scale the IgM to be able to see behind the veil. Now, let's say you're out there and you're like, you're just a quack chiropractor making stuff up to be able to have someone to treat. Okay, whatever. If you believe that, fine. I still think there's enough in this case with the GAD65 alone that's neuroautoimmunity. And he's got the blood-brain barrier targets. That's neuroautoimmunity. So there's plenty here that still need to be addressed, regardless of if the scaling is legitimate or not. I believe it is, but you can make your own call on that. We took action like it matters, and let's see what happened. We'll see that in a second. Real quick, stool findings: high H. pylori, candida, staph strep, parasite, low keystone probiotic, low Sig-A. Okay, so again, he's got dysbiosis, he's got pro-inflammatory bugs, he's missing a keystone species that should make up 5% of the healthy human gut microbiome. You're like, big deal, 5%. It's 5% of trillions. If you wrote me a check for that, I'd take it. Okay, and then the lab low Sig-A. We saw the study in Ava's case. Low Sig-A will travel to the brain to confer anti-inflammatory benefit. This is a panda's leaky brain, GAD65 autoimmune neuroinflamed patient. We want the Sig-A. We need that gut contribution to put those fires out. Real quick, I'm not going to spend a lot of time on this because I'm out of time, but patients will say they can't afford care. I believe that is not true. I believe if they're saying that we haven't communicated the value of the findings and what we can do for them well. So work on that if you're getting people saying they can't afford it a lot. It might be our communication and how we relay the value of the findings. But I say this to say Ethan couldn't afford care. But this is the first patient I know of in my history where even though he couldn't reach in his wallet and pay for care, he said, I'm not going to let that stop me. He opened a GoFundMe account for himself, raised enough money, paid for his care. That's awesome. Okay. So in paying for his care, was it worth it? At his 12-week review, okay, his 12-week questionnaire, I'd say so. 100% improvement in his anxiety and depression and OCD. 75% better energy. 50% improved gut. 75% better mental clarity. 100% elimination of pain. 75% better sleep. 75% better attitude. Okay, he's been struggling for 11 years with pandas. If he's feeling this good, of course his attitude's going to improve. What did he say? You can watch the video on my YouTube channel or on my website. Here's his testimonial. Here's what he wrote on Google. My experience at Functional Medicine Charlotte with Dr. Bartemus could not have been better. I now truly believe that functional medicine will be a foundation for the future of medicine, 21st century healthcare. From the first free phone consultation, Dr. Bartemus separated himself from any other doctor I had counted on in the past. I had complete trust in his process and his intelligence. He was completely transparent through every step from start to finish. Be transparent, practice with integrity. Okay. I am 28 years old and I spent 11 years fighting traditional medicine, questioning myself and trying to find answers for my panda symptoms. My health impacted my everyday life and everyone that I loved around me. Dr. Bartemus managed to resolve the majority of my issues in just 3 months, and I haven't needed any traditional medicines or prescriptions to maintain my health since. No more plasmapheresis, no more chemo drug, rituximab, for pandas. Please do not wait any longer to seek out the help you need. He is very affordable for what he accomplishes, and you will never pay for something that you do not need. Okay, so be Batman. You can do that. Okay, you can do that by using tools. We'll start it with Jordan, we'll end with Jordan. Anything worth doing is worth doing badly. You're telling me to be Batman. Why are you telling me to do something badly? Okay, well, you might not be Batman today, but we want to struggle forward, stumble forward to our Batman status. Okay, we've all been to seminars or watched webinars where we're like, man, that's awesome, I want to do that. And then 10 minutes later, we say, squirrel. And we forget what we want to do and we never pursue it. Or we don't do it because it's overwhelming. You're like, I'll never know enough to do this. I can't do that. Or you run a couple Vibrant tests and you get overwhelmed because Vibrant provides you so much information and you don't know what to do with it. Well, 2 things. A, go home and run tests today, or go back to the office after lunch here and run tests. Hopefully this presentation brought some of your patients into your mind where you're like, hey, I should run a neurozoomer on that person. Or hey, I should run this blood work on that person. Use Vibrant, run those tests, get that information, and then stumble forward into helping that patient get better yourself, help that patient get better. Well, it's overwhelming. How do I do that? Vibrant has clinicians that you can hop on the phone with, and they can take your test result and they say, also you tell them a little bit about the case, and they say, okay, this neurozoomer, these findings probably apply to the case in this way, and they can help you understand the results on your patient, give you confidence to move forward with certain strategies. Apply it. You go apply it, you get more confident, you get closer to Batman, you run more tests, you help more people, you make more money, you're happier, everyone wins. So use the testing, start today. You might not be Batman today, but you can start to learn a jab today, right? And then tomorrow you can kick somebody, right? And eventually you have a Batarang. And then ultimately you have a Batmobile. So go start. You can't get there unless you start. Start today. So test, don't guess. Test, don't guess. Test, don't guess. Individualized and specific, okay? You need to test. You need the tools to do it, to be Batman. You need the tools. Vibrant gives you those tools. Utilize them every single day. If you want to learn more, my book's out there. I've got videos out there. I encourage you to learn more and join the ranks of functional medicine, because the world needs us. 120,000 doctor deficit by 2030. We need you. We need you to be Batman. So thank you. And Adair, what do we got?
All right, Dr. Morris, thank you so much for that amazing webinar. I really appreciate how you started with emphasizing the importance of functional medicine, talking about diseases of spectrum, and then also that individualization piece, looking under the hood, using functional testing like the Neuro Zoomer Plus, the Lectin Zoomer, micronutrients gut Zoomer, to really figure out what's going on with that particular patient. Great insights today. So let's see if we have any questions. One back early on, just getting a list of all of the tests you run in addition to the one on the screen. Is there anything else that you utilize?
I use a bunch of different tests, but I don't run the same tests on everybody. So to me, protocol's a 4-letter word, because if I'm doing the same thing to everyone, then I might fall into the trap of, here's what I do and miss something. So what I do is I do a history and a medical record review of the last 7 years before I even know what I want to test. Like, that's what helps me and exam, right? So medical record review, history, exam gives me all the information I need to say, okay, what testing do I think I want to run on this patient? And then we run that, okay? But what can we run? Everything Vibrant offers and more, right? Blood, urine, saliva, stool, genetic, hair, whatever's there. So I know people want to know what do you do every time, but I don't. Sorry. I do blood work every time, but even that varies. But of course we need to see at minimum under the hood that way. So Pam, sorry, it's not the cleanest answer you want, probably.
That was great. Thank you for explaining. It's very individualized, so not the same for everyone. Let's see. I think I answered a lot of questions while you were chatting. So someone asked, is the micronutrient test called the whole blood nutrient profile? So if it's dry blood spot, yes, that is what it's called.
And you can add the omega-3 index to that, or essential fatty acid index to that. So that's great.
I did find the study, and it is from 2019.
Boom. Thank you.
Way to go.
That's the SIG-A study?
That's it. Yep. The SIG-A study. And I'm not seeing any other questions in the comments right now. So I think your presentation answered them all.
Hopefully. Or they didn't run away screaming.
Oh, everyone is still here. All right. So thank you so much for attending today's webinar, and hope you have a vibrant rest of your day, everyone. Take care.
Yes, thank you.